not as an elected official, but just a caring citizen, which is frankly what I think a lot of you are in this room. You just want to see hope for the community and a way out of this difficult time that we're in that is in all rights self-inflicted, because in most cities around the nation or world, you don't see this sort of crisis. And so what I want to do is just have kind of a conversation with you and share some values. And one of the things I've always liked about Hope for the Homeless is it's really focused on outcomes, right? It hasn't really focused on dogmas or what a flavor is, and then we stay on that. It's always like, well, where is the information saying we should go? And it doesn't just measure activities. It says if we're going to do something, what are we going to get for that doing, and making sure that it's something that's worth doing, and then making sure that we're going to measure it along the way. And if it's not working, have the decency and the understanding to say, hey, we should probably pivot. It's something that we often do in business. And so this job going from a private CEO to a public CEO has really been seamless for me, because the techniques are the same, the challenges are different. And I've always said that going into this job, we are going to have one crisis in this city. Unfortunately, along the way of that crisis, we're oftentimes challenged, and I'm in the midst of a challenge. I never, ever thought, nor would I want, that somebody in the White House would ever call out my name and call me a pansy, which, frankly, my kids don't even do. So I'll just put it that way right now. So they gave me 15 minutes, and I'll do my best, but it's an important conversation. So if I run a little long, please allow me the courtesy, but I'm going to share some numbers with you, some idealisms and some value, and I hope you kind of share along this journey. So I had a conversation with all of you last year, and I said that if you elect me mayor, that I'm going to really focus on three key values, three key goals. And the first was we have to end unsheltered homeless. It has to be done first. The second was we were going to then reduce the burden on our public safety system, because it was being spent so much of our time is helping those that are on the street, taking away so much of the resource to others that were in need, and our response times were just really poor performing. The third was then we have to focus on revitalizing our economy and improving the livability. But we have to go through that linear approach for us to succeed as we go along. And I'm not moving along yet, so I'm just kind of doing my preamble, so this could take a few minutes. And in so doing those three things, I distilled the first goal, the first very important achievement, into 6 key goals. And then as I went along, I started building the system at the city, and I set up what's called a shelter to housing strike team, because we have to treat the crisis like a crisis. And then I started counting down from the first day I entered office until today. My team and everybody can tell you, in every meeting we go into, we start with, there are 32 days left until December 1st. We have to restore confidence in good government. You must learn to trust good government. We've set up a very important goal, and we want you to, at the end of the goal, know that we can do big things together. And I want you to know that, as well as starting with how much time we have left to December 1st, because my team must know we have to hit this goal. I also want to make sure that everybody knows along the journey there are people at stake if we don't hit the goal. On Tuesday, Portland Solutions, the team that I'm enlisting to care for Portland, reported to me that along NATO Parkway, underneath the Morrison Bridge, as many of you had drove by, some of you had walked by, we found a body. For 4 days, that person laid there. And so I always go back to, there are names for these individuals. And when we do nothing, do we not become complicit in that? Do we not normalize the humanity or the misery in our community? And so I've had that conversation with the city, and the city elected me to be mayor. And my focus is we have to value each one another, because that child was somebody's son or daughter. And so this has grave consequences that I share with you tonight, this conversation. And so we're going to start with that first goal. There are 6 key goals. The first thing is we have to end tent distribution. When I inherited this job, the first thing I did was started talking to county and let them know we delivered 6,400 tents to people in their most worst time of need last year, 23,000 tarps. We are actually fostering the behavior that we want to end, and we're doing it through a public service. Who have we become when that is what we hand out to somebody in their greatest time of need? I'm happy to say that the county, after many, many conversations and never letting them know who are we if we are continuing that, they discontinued that in April. But their providers haven't been told through guidelines that they can't do it. So there's this argument going on. If you are going to work with the city and you accept our contracts and our funding, you accept a clear guideline. You will not hand out tents. And it's creating a difficulty between homeless service providers who were used to being provided funding by the county and now are accepting funding from the city. And they've come to me. I remember when one of our larger service providers said they're conflicted. And I said, there's no conflict in the city. Morally, legally, logistically, we have no conflict at the city. If they want to work with us, we want to work with them, but this is the requirement. What I'm going to ask you at the Hope for the Homeless is to do it as well. I'm going to ask for you, if you hand out funding to a homeless service provider in Portland, I would ask that you provide that same guidelines. We will support you. However, we cannot foster the behavior that we want to end in our city. You cannot hand out tents. We must have shelter available for those in need. It's a difficult choice, but the sanctity of life means that we never, ever kick somebody to the curb, ever again in our community. Next, please. Goal number 2, a safe and appropriate diversion. This is a very important slide right here. It was one of the most important wins that we had. We started this group or this program called Reunification. It is a national alliance to end homeless best practice. It's number 2. It's their focus on making sure that we house people as fast as we can. And sometimes the most valuable housing is with a family member. So this is Giovanni. He was held hostage on the streets of Portland. Mentally ill. He's from Brooklyn. He didn't have the funding to get back home. All we had to do was provide resources. We asked him, can we help connect you with your family? He said, my mom is going to be mad at me. We said, we're sure we can contact her and help out. Sure enough, she hadn't heard from him for 3 years. On our streets, being preyed upon, mentally ill, a good person. He didn't have the mental acuity to get back home. We flew his pastor out to then help Giovanni. This is the reunion with his mother. I mean, it still makes me kind of cry, if you will. In Phoenix, they have a 10% reunification rate for everybody that comes into coordinated entry. In Boston, it's 8%. I'm holding our city accountable to 10%. We're going to reunify 14 to 24 people per week. Our best week so far, and I haven't even started. December 1st is the date that we are beginning this program. Our best week so far, 18 people. What's amazing about that is housing. But what's more important, it's housing with social services connected, the most important type of housing. It is incredibly important to go along. We've reunified 140 people so far, saving $41 million in Portland, because if we had to build housing for that person at $300,000 per apartment, it's a simple number to follow through, less than $10,000. And I guarantee you, it's going to stick with Giovanni. Isn't that what we need to be really focusing on? Is not to just be thinking about a one solution or only one way, but find the need, fill the need, and it looks so much different. If there are 7,000 people, there are 7,000 different needs. We have to be flexible in our approach. And I want to read you off some of the 34 states we've helped people get to so far. Houston, Texas, Johnson, Tennessee, Martinez, California, Newark, New Jersey, Newton, Kansas, Orlando, Florida, Portland, Maine, Ukiah, California, Fargo, North Dakota, Bismarck, North Dakota. Here's the curious thing about Bismarck, North Dakota. Second only to Seattle. It's the highest number of reunifications we had. Bismarck, North Dakota. y'all know there's like, with all due respect, with anybody that might be here from Bismarck, there's like 100 people there. But I say that in tongue in cheek because something's going on. It's not just about outflow, it's inflow. So I told my team today, as I see the numbers, something's going on there. There's something not right. So I told my outreach team, the next time you have or find somebody going back to Bismarck, North Dakota, let's start interviewing them. Let's find out what's going on. Is the mayor sending somebody to Portland? Are we so permissive that our national reputation says that you can send somebody to Portland without a loved one? That's on us. And that's important for you to recognize because inflow is as important as outflow. We must know why others, in some cases, think Portland is the solution to our national homelessness crisis. I'm going to challenge you with that because there are hospital networks that are hospital dumping in Portland. You may have read about a story recently. So I took that treatment center, that hospital, I sent them a cease and desist because anybody in Portland is going to deserve my care and my focus on safety. Every single person, whether you are a federal protective service at the ICE facility. When I was challenged with Christy Noem and she said, my officers are not being treated safely. I challenged her. I said, you're not treating my citizens safely. I promise to care for your officers and I will try and keep the peace. But in turn, I need your help to keep my citizens safe. All four corners. She was surprised by that. She shouldn't have been. But if you're in Portland, we care for everybody in Portland. But in the same regards, if you're sending or dumping somebody in Portland, I'm going to find you and I'm going to sue you because you are not going to use Portland and take advantage of us when we are already overwhelmed. So our emergency rooms, if you go there at night, you will see the suffering on gurneys because we're using it as a shelter system. And it will break your heart. I will help any hospital that turns to me and says, I need help. But we care for people as we go along the way. It's not mean. It's actually the opposite. It's caring. It's where's the inflow, where's the outflow? And these are people with names. And we are never going to not treat somebody who's in Portland with dignity and respect again. The next goal. This is one you've heard a lot about. We're setting up an emergency shelter system. We have an unbalanced system. We focus so much on preventative focus like rental assistance, and let's set up housing, and let's focus on long-term rental assistance for eviction system. All very, very important, but we've weighted it to one end of the continuum, and we forgot about the emergency shelter system, that front door to ensure nobody ends up on the street again. And we're making big moves. We have 810 beds open. We just announced 280 more. We're at 1,090, and my team knows they have 300 more to go, 400 more to go before December 1st, and we're on target. I see Matt Stein over there at Union Gospel Mission, and Lance Orton. Where's Lance? So really, I would clap. They have been, Lance Orton at City Team has been one of my kindred spirits. He has just defaulted to trust and has jumped in and has helped beyond belief. Matt Stein just says yes. And they have shelters that we either have opened or are opening, and I owe you a debt of gratitude for just answering the call because we need everybody to be focused on Portland. More are on the way. I can't tell you if we need 1,000. I can't tell you if we need 2,000, but I can tell you I will find a way for the number we need to care for those that are suffering on the street. Next slide. And, oh, excuse me, would you go back one? Thank you. It's pretty amazing for the amount of attacks that I've received and the fear in our community. When you actually care for people, the outcome is quite good. We're seeing business levels in those shelter communities increase. We've seen crime decrease. It's working. And I know that some of you, if I cite a shelter, just know we're caring for the community with engagement zones. When we open a shelter, we have a 1,000-foot zone. We will do street sweeping. We will do power washing for sidewalks, graffiti abatement. If a tent gets posted or set up, we immediately address it. If somebody's doing drugs or dealing, we immediately address that. Any criminal activity, we are on it, because if you host a shelter, we want your community to immediately improve, and it's working. And so I'm happy to say that those communities, after being yelled at a lot, if you've seen some of the stories on the Northrop in particular, they said it's actually working quite well. Not bad. Care for your community members. It's amazing what happens when you do that. We are not going to push community members from one neighborhood to the other anymore in Portland. Next slide. Goal number 4, participant engagement. Together, that means that we have to have a safe bed for every person every night to make sure we're not moving people from one side to the other. This is some of the data. This stuff means a lot to me. In 2017, on the left side, as this slide illustrates, our emergency shelter system had only a few people that stayed over a year. Only a few. Nobody should ever stay over a year in a shelter. Today, now, it's hundreds. Applying continuous improvement in Portland, our shelters aren't like this. This is primarily county data. I've set up new guidelines for my shelter systems that I'm going to work on. And I've asked the county to do the same, because you have to help people through the system. We've set up participant engagement requirements. If you come into an emergency shelter, I want you out of it just as fast as I can, but you have to engage in the outcome that you want to be a part of. I need that help. There are stay limits. You know, if you're in our 24/7 shelters, you have 120 days. I get it. We have a lot of people with acuity issues. I don't care if you go beyond 120 days. We are trauma informed. We will help you through it. But we want you to know this is not a time indefinite approach. I need you to help us with your outcome. And then bed utilization. We don't just say that somebody is assigned a bed. You must be in that bed. That is a high cost emergency service. We do bed checks. Those are things that right now, in some cases, the county isn't doing. And you can see the outcomes are not improving. So when you engage people, you actually have extraordinary outcomes in the process. So when I changed our guidelines a couple months ago, I got the list from our Clinton Triangle. We had 6 engagements, 33 subsidized housing apps. A guest was approved for an apartment. A guest is approved to MLK Manor, an apartment. 3 guests gained employments. 2 guests completed flagging certifications. Treatment. 2 guests went into detox. 3 went into outpatient treatment. And the list goes on. And my team just said, oh my goodness, we never had this sort of engagement, this throughput, this focus on moving to the next step. That's what I want you to know, is you have to engage the human spirit. And when you do that, it is incredibly powerful. And I think you know that. And so I want you to turn the next slide. And so this is just one more thing that I want to bring up to you. In 2017, when the county took over our homelessness system and they became the sole point of contact for adults and children and families, our average stay in a shelter was 23 days. When we moved and removed the engagement requirements and the bed utilization and the stay limits, we're at 77 days now. We have enough capacity. If we just went back to the 2017 figures, we have enough capacity to care for everybody on the street. And in 2017, we were spending $40 million annually. Today, $400 million. So when you think about that, it's quite amazing. And I just want to let you know that all we have to do is change some of the things that we're doing, not just those in the suffering on the street. How do you improve throughput and get it to work twice as fast? You can easily just make some changes to accomplish that, and we're doing that. Next slide. Number 5. This is what you've been hearing about this last week. So before I wanted to do any sort of enforcement or asking people to come in, I had to have the shelters available. And as of Saturday, we're beginning enforcement again. We have to reestablish community standards on safety, health, and sanitation, not just for those that are suffering on the street, but for us as a community as well. When we choose not to enforce existing policies, we create new policies. If I walk by garbage on the street and my team sees it, I've created a new policy that garbage on the street. I keep a garbage can in the truck that I just bought, because I'm not doing it anymore. And I'll explain to you a moment how that works. And worse, if we don't, it means we expose people to harm of leaving them in terrible conditions. We have so much garbage on the street, just garbage, because when you don't even care for humans, why are you going to care for just the livability in your community? We're reestablishing that community standard. And we all know the terrible toll this brings to your neighborhoods as well. And so we can really start increasing and improving the livability in our community by doing that. Additionally, Portland has become a place where we have uninhabitable RVs. There is no place in the city where you can use brown, gray water, or black water to drop it. The closest is Tigers, and so we certainly know that they're not doing that. So one of the things I did when I came into the office is we were doing 38 RV tows per week. We're now doing 96, per month, 36, it's 96 now. And we're helping those community members in. I asked the county for connection to family shelters, and they took so long to give me the proposal, and then they were going to charge us $355 per bed per night. I couldn't do it, and so I immediately set up 280 beds through Portland, because we could do it at a tenth the cost, and we had them open, and we're going to have them open, within 3 weeks. You see, we have a humanitarian crisis. We're not going to wait, and we can, with your help, fund a better solution. Now, I want to also let you know something that occurred just this past week. So I was walking to City Hall, and there was a fella on his back with his legs kicked up on a garbage can, just laying there. And immediately I saw him, and I walked up, and I said, whoa, hey, man, I want to help. What does it look like? But you can't be here. You can't be on the curb on your back laying here. You see, I'm the mayor. I didn't tell him that. But I'm thinking to myself, I'm the mayor, and if I walk past that, what is it saying about us? That I'm not guiding the city. I'm certainly not governing the city. So I stopped him. I walked right up. My security guards got incredibly nervous. Sorry about that, fellas. And I said, hey, man, I want to help you. I can't have you here. And I was dead serious. And I put my hand down there, and I helped him up. And the guy was huge. And I said, hey, I want to help you. What does it look like? Where are you from? And he said, well, I'm from Redding, California. I said, hey, man, is your family there? Is your mother? Is there somebody I can connect you? I can help you get home. He said, no, Mr. Mayor. Oh, by the way, I really appreciate you. I see you picking up garbage all the time. I'm picking up garbage all the time, too. I'm like, hey, thanks a lot. And he said, no. I got a place. I've got a house in Northeast Portland. I said, you got a house? I said, great. I said, well, what are you doing? He goes, I was just, picking up garbage, and I was laying on my back. And I said, oh, all right. What's your name? He says his name is Disney. Nice guy, simple guy. We see these individuals who need help. I said, Disney, here's the thing. Keep picking up garbage. If you do it, I'll do it, right? And he says, absolutely, Mr. Mayor, I'm on it. And I started walking away, and I stopped, and I said, hold on, Disney, I also need another favor from you. I need you to never lay on the street in Portland again. And you know what he just did? He just looked at me and says, okay, Mr. Mayor, never again. Do you see when you engage with individuals, the outcomes are positive? Here's what I need from you. It's called Person Down. We have a new program. It's called See, Care, Connect. All of my public safety specialists, police, fire, Portland Street Response, chat, all of our departments are being retrained. When you go on your priority call, your fire, your police report, that's your priority. You go on it. But when you're driving back to the barn, when you're coming back, if you see somebody on the street, it is time for us to stop and start asking, I want to help. What does it look like? But you really couldn't be here. But I have shelter. I have this. What I want you to do is I want you to be a part of the change in Portland that you want to see. If you see somebody in distress and you feel comfortable and confident and you can go and talk and create a relationship, do it. I want to help. What does it look like? But you really can't be here. It shows that we're really not a caring community, and I know you are. And if you don't feel comfortable with that, we have a new number for PSR. It's just a dial-up number. Or call 911 and say somebody's lying on the street in distress. I hope you can do that. because that's what we're going to do. It's winter. We're not leaving people on the street. That fellow who died underneath the Morrison Bridge a couple days ago, we're not going to let that to happen. But I really do need you to recognize you are the change in your city that you want to see. And goal number 6, and I know I talked over. It was a good meeting, and I appreciate that. So, but I just want you to know that homelessness is a housing problem, full stop. Everything I've talked to you about 1 through 5 is triage. Triage we must do. But at the city of Portland, the governor and I are partnering. We just determined through our council's support, we're not going to charge system development charges. Those are the fees that we charge when you build up a new home. It can be anywhere from $10,000 to $30,000. We've waived it for 3 years. You build in Portland, we're ready to help you. If you're a developer and a builder, it's time to come to Portland and build. We need housing. We need jobs. And we're ready to help revitalize the city that we have. There are other things we're doing as well. I funded a program called the Portland Housing Access Initiative. It's home share. We all have heard of home share. There's Pad Split in Atlanta that's coming here week to week, month to month, bedroom rentals. Do you know there are 200,000 empty bedrooms in Portland right now? We don't have a housing problem. We have a housing access and vacancy problem. Starting January 1st, if you open up a bedroom, we're going to give you a $1,000 grant. It's time for us to rethink what housing looks like. 100 years ago, boarding rooms, home share, it was essentially what all of our Portlanders used and utilized. We need to rethink what it looks like to have a high school kiddo that graduates high school and has a decency of a room or an SRO, or an elderly, our fastest growing homeless population. The decency and the dignity of somebody who lived in our city should be able to live with decency and dignity as they age through life as well. You see, being creative is what we're doing, but we're not waiting, we're not thinking, we're just doing. I owe the governor a debt of gratitude. She has been great. So if you're a builder, let's get going. So now I'll just conclude, and forgive me, Doug and Carol, if I spoke a little long. I just wanted to kind of let you know some of the things that we're doing. And we're not waiting, and we're not asking for permission. We're moving. This last couple weeks have been really difficult for the city, interesting for me as well. For the first time, I was brought into meetings and or large gatherings like this, sat in the front and then attacked. And I was really surprised by that. I hope you've heard what I've said has been heartfelt, well-researched, and we're acting. But there are dogmas in the city that are entrenched, and there are funding strategies and streams that people want to keep intact. Surprised, but I'm not doing anything extraordinary. I'm not taking anything away from anybody. I'm just saying that we need to balance the continuum. If somebody needs a bed for a night, should we not have it as a community? If somebody needs to go into transitional recovery housing, shouldn't it be ready? If somebody needs housing at the end of that journey, should we not have it as well? And I answer, yes. At the city of Portland, we are balancing the continuum, and it will never, ever include the street again. So thank you all for your time tonight. This is a pleasure. Thank you.